So good afternoon, dear on-site and online participants. I would like to welcome our other guests here. We will have a special panel now. We will have a so-called Pecha Kucha session with NGOs, migrant NGOs, reflecting impacts of COVID-19 pandemic situation in their communities. And I would like to welcome Eva Valentová. She is a program manager of Association for Migration and Integration, and she's going to lead the panel.
Thank you. I will go there. So, good afternoon to everyone. Thank you for having us for this opportunity to present the perspective of NGO sector on the situation of migrant women, but not only in the Czech Republic. This panel discussion is taken from the support of the Office of the Czech government under their granting scheme for gender equality. So that's why our focus is on women. And the discussion is meant to bring on the spot the practical experience and perspectives of the non-profit organizations, where we will talk about what are the conditions of migrant women, but also of women in general and migrants populations in general in the Czech Republic, with the perspective of how the pandemic of COVID-19 has affected their daily lives, what were their struggles of work-life balance or other new structural limitations to these disadvantaged groups. But on the other side, we know that there were various initiatives and positive actions from migrant diasporas in the Czech Republic. So we would like to try showcase also some of these positive examples, not to be only critical or complaining about the vulnerabilities. So I am delighted to welcome here the 4 panelists who are all from the local NGOs here in Prague. And among them are actually 3 migrant-led organizations or representatives of these organizations, and 1 representative of an umbrella of women's organizations at the national level. Each of these organizations actually focuses or works with women and migrants in slightly different ways. So it will bring also a diversity to the topics we will tackle with. And so let me introduce from my left side Alena Priščepenko. She's representing Association Dr. Chekhov, who focuses on healthcare workers with migrant background. And she will talk also about the access of migrants to COVID tests and vaccinations here in the Czech Republic. Then we have Mr. Stanislav Chodsky, who represents a project, Anonymous Migrants, and he actually provides psychological support to migrants here in Prague and works also with perpetrators of domestic violence. So completely different topics. And then we have Anastasia Janina. She represents Association Matertera, and she will talk mostly about the empowerment of migrant women, the women's leadership, but also the access of women to Czech labor market. And last but not least is Hanna Štelcrová, and she's representing Czech Women's Lobby, which is the umbrella organization of 36 women's organizations working in the Czech Republic. And they were leading also the coalition Invisible Power, which focused on disadvantaged groups of women, meaning migrant women, but also Roma women. So they will bring you their presentations in the format of Pecha Kucha, as we mentioned, which should be quite a vivid and quick presentation to showcase the general picture of their work, and then we will develop further the topics in the debate. And actually, I will end up also the part of presentations to show you also what we do in the Association for Integration and Migration, as we are actually the only NGO who monitors more systematically and from different perspectives the lives of migrant women and their inequalities here in the Czech Republic, but we are also active at the European level. So I will give the floor to our guests, and we will start with Anastasia Janina from Matertera. So.
Mm-hmm. Yeah, it works. Good afternoon. My name is Anastasia Janina, and today I'm representing our organization called Matertera. I work in Matertera as career counselor, and I also organize some kind of courses and events for migrant women. In Latin, Matertera means mother, sister, and as we get it, it symbolizes a woman who gives a helping hand at a time when a mother or something close is not present, and woman finds herself in completely new situation, in uncertain environment, and she has to adapt to new conditions. Our mission is to help migrant women or women with migrant background to overcome barriers and support each other in personal and career growth. And we also try to form a community of women who have decided to live their dreams and decided to support each other. Although our events and our activities are aimed at women with migrant background, we are also open for any other women who have gone through the process of naturalization, and also local women who just want to participate in our activities. And also these women can benefit from our activities as well. What we do, we organize different kind of events. We organize personal startup cycle, which is cycle of workshops oriented on working on own projects and initiatives, both non-profit and commercial. We provide counseling for women, especially career counseling, coaching sessions, sessions on event management, personal brand, project management. We also organize a cycle of workshops aimed at employability of migrant women. We organize late talks, which are online meetings oriented on improving Czech language skills and communicational skills in Czech language. Also, we have our special project, which is called Time Bank. It's a service exchange which uses units of time instead of money. And also, we organize storytelling meetings aimed at practical sides of discussion topics, for example, sharing our experiences with volunteering and civil participation, career guidance, intercultural work, to give new ideas and to inspire migrant women to change their lives. During the pandemic, we managed to finish our international project called Power Up. The aim of the project was to create materials to support women in their social and labor inclusion, to empower them and to upskill them with transferable skills. We participated in this project along with 3 other organizations from Bulgaria, Portugal, and Spain. And we organized different activities such as creation of open online courses for professionals and for women with migrant background. These courses were aimed at entrepreneurship skills, self-employment, civil participation, digital citizenship and cybersecurity, and also gender empowerment. We also created a power-up handbook, which is a set of techniques and methodologies to foster the social and financial independence of women. And we managed to organize a conference engaging professionals on local level and bring in materials to professionals who work with migrants here in the Czech Republic. So thank you for your attention.
Thank you. So now it's turn for Alena Prištěpenko from Dr. Chekhov.
Hello, everybody.
So this one,
Okay.
the pink one.
Okay. Yes. This one.
Okay.
Here. Oh. Okay. I present non-profit organization Dr. Chekhov. We support healthcare workers who obtain their education abroad. We have official and non-official members. Just difference is that officials it's paid membership who helps us somehow, and unofficial just follow us. We are a women's organization. We created a little poll, and 70% of us are women, and vast majority of us raising minor children. We provide all informational support. We highlight all the steps of approbation exams, because doctors and nurses have to pass board exams in the Czech Republic to get a license, which will let us work there. We provide educational support. We coordinate with language schools, and we have different discounts for our members, because it's not very easy to move from, for example, Ukraine to the Czech Republic, and to pay for these language courses. We share knowledge of people who had already passed this way and succeeded in this approbation board exams. Also, we share some information which will ease assimilation of the future healthcare workers. And there are some pictures of our members who is always ready to help, and just the kind of persons. There are some programs in which we took part. That's Medivac 1. We help some citizens of Belarus to find a job here. It was not doctor's job. It was just some job, but we helped us to move here. And that was we help 28 healthcare workers to find medical support here in the Czech Republic. The majority of our doctors work in rural hospitals where, unfortunately, Czech citizens don't want to go, and we support this rural medicine. That's Anna, one of our active members. In early days of pandemic, we created a list of healthcare workers who I was among them, who proposed their voluntary help to fight against the COVID-19. Unfortunately, we sent this list twice or three times. Unfortunately, we got no any answer from the Ministry of Health. Also, we have a second-hand bookstore. We share our tests and exam experience, and it helps. The first conference took part before the pandemic, and here you see our head, Olga Zhernasek, speaking on this conference. We don't wear masks. A bitter pill. Unfortunately, the amendments were accepted, and in this August, and these new amendments to Act of Residence of Foreigners in the Czech Republic almost tripled fees for medical insurance for members of our families, which ruins our activity in the Czech Republic. The price of insurance for their members of their family is too high. No new workers are able to come here, and maybe of highly experienced healthcare specialists consider leaving country. I'm among them as well. Thank you for your attention.
Thank you, Alena. We will come back to the topic of healthcare insurance in the discussion because it's quite a hot topic in our environment. And I have to say that it was actually the first public presentation of the association Dr. Chekhov. So congratulations to Alena. And I think it's the similar situation for Anonymous Migrants, and Mr. Stanislav Chodsky will tell you more about their activities.
Hello. Thank you for the opportunity to be here. My name is Stanislav Chodsky, I'm a psychologist, and today I'm going to tell you about psychological support for Russian-speaking migrants, which we provided within the project Anonymous Migrants. Telling we, I mean 4 psychologists and the project manager, and we've been doing that work for 2 years. What is important to say? That we belong to different psychological schools, and we conducted these group meetings accordingly. And what is the most important thing, that these groups were not psychotherapeutic groups or training groups. I would say that they were enlightening in nature. What do we know about reasons why people leave their motherlands? I guess there are plenty of them, but honestly, we didn't consider them within the project because this wasn't the case. What we did care about, what the state these people got into after the arrival. I mean, simple things, difference between expectations and reality, feelings they felt, and coping strategies that they chose to use. And yeah, that's all, I guess. I would say that none of the participants told us about daily problems right away, at least. Most of them reported that they felt the lack of communication in comparison to what they were used to in their own countries. And especially it was relevant for those attached to their spouses. We can talk about kind of bubble of Russian speakers, and this is not the best way to integrate here. And these people told us about such feelings as shame. For example, I've been living here for quite a long time, but still don't speak Czech well. Or fear, for example, about that the natives will be biased against me because of some political reasons, for example. And even though I said that these people didn't talk about daily problems, this is not completely true, because they didn't start from that. But then after several questions, they shared that even a little task turned into a big deal. And you can imagine what pressure it could create when you have problems even when you want to go to a pharmacy or to a store. So it's quite difficult. And all of these reasons force people to gather together, to build communities. And on the one hand, this is a good decision for decreasing stress. But on the other hand, it may contribute to a greater isolation. Again, we can talk about this bubble and what I said before. During our meetings, we covered 4 topics. You can see them on the slide. Each facilitator took one, and the second one was mine. I focused on differences in coping strategies within the couple. I mean that everyone has his own strategy in overcoming stress. And usually people may think that these strategies are the same, but it's not true. And people may have been living together for 15 years and didn't have a chance to see one or several sides of each other. And having gotten a new country, they face new obstacles, new circumstances, and they start acting in a new manner. And there is a high chance that it will surprise their partners and cause conflicts. So we discussed this primarily. And when the pandemic came, we decided not to stop, but to continue online. And it was a good decision, I guess, because we got this opportunity to expand the geography of our project and compare situations in different regions. For example, we got to know that people from Brno who live there, they study language faster than those who live in Prague, just because of a few Russian-speaking people around them in Brno. And this was an interesting thing. So that's it. What I'd like to say here, that I believe that if we want to help people avoid typical migrants' mistakes, we should continue such projects. I'm not sure that the same project, but something like this. Yes, because it's really very, very important. There are plenty of mistakes that we can do, and we can help others to avoid them. Thank you very much.
Thank you, Stanislav. Now I will ask Hanna Steltrova from Czech Women's Lobby to give her presentation.
Good afternoon, hello. Thank you for having me here. I'm the director of Czech Women's Lobby, and we are the umbrella organization of over, right now 36 organizations, but we welcome any new organizations working with women, and together we are defending and promoting women's rights in the Czech Republic. We are trying to bring the real problems of women up to the political level, so on a principle of participation. So together with our organizations, we cooperate in the network, and then we bring these issues into in discussions with our politicians and a state sphere. Our mission is to support all women within the society, regardless of their race, ethnicity, ability, sexual orientation, age, religious or faith. And we also focus on the vulnerable groups of women, even if we do not have the organizations within our network. But we do right now, for example, for Roma and migrant women, as was already said. But if we do not, and there is a problem, we try to solve it even so. But very important for us is to know the experience of these vulnerable groups and to see their perspective. And therefore we have had this project called The Invisible Power to get more in touch and in cooperation with our 2 organizations. One of them is Association for Migration and Integration, and the other one is a group of Roma women, Manushe. And we were empowering women from marginalized groups, and together we were raising also awareness about the problems of individual women, but also a group of women in these communities. Our main activities was discussions, participation within the Czech Women's Lobby structures, which are working groups, cooperating meetings with these organizations, so we would find the strategies for advocacy work, but also the women got some support from these organizations, particularly like mentoring or learning how to do storytelling, and even had some interviews into the media. So the biggest impact was we kind of together put these stories into 2 chapters in our shadow report on the state of gender equality, which is like the first time from their perspective. So there are 2 chapters on Roma women and migrant women, and the shadow report is available, unfortunately, in Czech here, printed, but online you can also get it in English. Czech Women's Lobby is also advocating within for women and their position within the COVID pandemic crisis, because this gender perspective is very important, and we lack this perspective in our political view. And during the COVID crisis, we were raising awareness about the violence against women, which was increasing at homes, or there are numbers like 40% increase of people calling for the services. Also, there was this obstacle for in obstetrics, where women are not allowed to take their partners or close person into the hospital while the COVID pandemic measures were, and also this impacted the vulnerable groups of women, and also economical impacts which were more on women than men in some cases, mainly because women are the caretakers more than men, and therefore also unemployment during the COVID pandemic was worse for women than men. So these were our important issues that we rose during this time, and we will keep doing that when necessary in this 3rd pandemic situation. Thank you.
Thank you, Hanna. I have to say that Czech Women's Lobby has a quite strong position within the NGO sector, and they prepared also very important recommendations to the policymakers, but she will bring more details in our discussion. And now it's my turn, actually. I'm sorry, I need to change the position. So our association is leading a program called Women in Migration for around 10 years, but we actually are one of the oldest NGOs working with migrants in the Czech Republic. We were established in the early 90s, and we are defending the rights of migrants and refugees in the Czech Republic of all categories and irrespective of their legal status. And we are providing a very wide range of support to these people. The core activity is counseling, legal and social counseling, and we provide also psychosocial support and try to develop a new profession, the services of intercultural workers. But then we have a wide range of other activities, from capacity building to migrants and professionals, through advocacy and policy work at all levels, local, national, but also European, as I mentioned. And we do different types of lectures and events, also to raise awareness about the situation of migrants towards the majority society, so the Czechs. And what is very important for us that we are members of several networks at the national and also European level, and they help especially in our advocacy efforts. Why we started to focus on migrant women specifically? Because we could observe in our counseling that this population is increasing, and especially that women have more tendencies to settle down in the Czech Republic permanently than men. And at the same time, they are facing multiple disadvantages and different forms of discrimination. And at the same time, they remain quite invisible in the eyes of policymakers, the government, but also in the research. And for example, the Czech government also is quite reluctant to adopt international commitments which could give minimal standards to some positions of migrant women and in women in general in the Czech Republic. And specifically then the migration and integration policies as such are still gender blind, and we try to push to create specific policy measures for this group. So as integration is a transversal area, it could be quite overwhelming to focus in details on all aspects of lives of migrant women. So we try to put focus on several specific topics together with our colleague Petra Ezedin. We work on care and domestic workers and their situations. You can see even the example, the blue publication is actually, she was co-authoring this research, as well as the last one, which is actually tackling with the intersectionality of migration, gender and aging. And then we work also a lot on domestic violence in migration and mental and reproductive health. So these are the main topics we try to work on. When we work specifically or directly with migrant women, we provide them counseling, as I mentioned, and therapies, but we also try to bring their stories more public. So we provide storytelling trainings to them, but also different types of community events. And then we try to engage them by providing their storytellings in live events, but also through different types of media. During the COVID period, it was very crucial to provide them of different various information regarding the COVID rules as such, but also other types of obligations that became quite new and unknown, and the state authorities didn't provide information in other languages than Czech and English, for example. So these are only examples how we use the storytellings or in what forms. We have a special blog with stories of migrant women, and many of them participate by writing their stories in articles. Then we have a cooperator that makes radio casts, and we shooted also a documentary movie, which is actually available also with English subtitles if you are interested. And we inherited a cartoon exhibition, which also gives some other stories of migrant women. So you can see that those stories can be provided in very different forms. When it comes to the raising awareness of the majority society, or the professionals, so we were quite successful with doing seminars, which we converted into webinars during the COVID times. And as Stanislav mentioned, it helped us to reach out people also from the regions. So I think this can be one of the positive aspects of the digitalization of our work. Then we participated together, for example, with the associations present here, Czech Women's Lobby and Matertera, in various debates, live and online as well. And we participated in various campaigns, media campaigns, or advocacy campaigns, and we also produce some of them. So you have on the pictures the examples of these activities. The advocacy, I would mention only what we did recently. We try to cover all the topics of our focus in our advocacy and monitoring work, but lately we had to give more attention to the issues of reproductive health and specifically abortions because of the events that happened recently in Poland. So there were now the policymakers are starting to pay more attention regarding the access of EU nationals to abortions in the Czech Republic. And then, as Alena mentioned, there was a huge legislative amendment which concerned healthcare insurances, and we fight it a lot to get public healthcare insurance for children who are excluded from the system. So that's what I could say for our latest work. Thank you. Thank you for this part. Now I will start. I will move maybe there. It's quite complicated to figure out how we about the setting when we are 5 and the panel is for 4. But I will give or raise the first questions from here to all the panelists, because I would like to ask them how the pandemic has impacted your organizations or your work specifically in both negative or positive ways. So what were your main struggles which arrived or appeared from this new shocking situation 2 years ago, but at the same time we are wondering also what opportunities it brought to you. And you can start how you want. I will take one of the mics and one will...
Hello everybody. For sure, everybody heard how medical workers struggled during the pandemic, and I don't think that's the topic to cover. However, we got positive things, and that's a miracle, because before the pandemic, the percentage of doctors who passed those exams was fluctuating between 10 or 20%, so it was very hard exam. And after the first wave of pandemic, Czech Ministry of Health, I don't know what happened, but more than 50% of doctors passed this exam. And percentage of nurses, it almost doubled. I don't know, that was the same nurses, same doctors, and same, but the majority of them begin to pass. And after the year of the pandemic, the Ministry of Health issues amendments that we have 5 attempts instead of 4, and we have 3 years of practice for every attempt. It's our proposal. Our head, Olga Zhernasek, she visited, I don't know, it was our struggle. It was that's our amendments, and it eases life for the future healthcare workers who will came to the Czech Republic, and as a conclusion to Czech citizens.
Okay,
I think
great.
Okay.
Yeah, I can continue. Can you hear me when I'm in the mask? No? Okay. Thank you. You're a doctor. Okay. Again, on the one hand, we can say that people started suffering more. I mean, the isolation grew, and that's why we've got more participants in our online formal groups. On the other hand, it was much more anonymous, because we could arrange these meetings without video, so without names, without anything, and it became really anonymous meetings, and it helped us to talk about more difficult, more personal topics, and this was good, I guess. And as I said before, we could expand this geography of the project, and I would say that positive results were, I mean, that they're much more positive than negative. Yeah, that's it. Thank you.
Of course, for us at Matertera, the pandemic affected our activities. We switched them into online mode, and it helped us to reach out for clients that we didn't have opportunity to reach out for. For example, some women cannot participate in our events because they live outside Prague, and right now they had opportunity to attend our online workshops, online activities. And also it helped us to gain a good reputation and gain their trust, because we are a relatively small organization, and in comparison with other organizations, like big ones, we were small, we were young, but the pandemic helped us. But on the other hand, at the beginning of pandemic, the situation was different. Women were hungry for change. They wanted to participate in online workshops, online activities, and right now, after almost 2 years of on and offs of lockdowns and restrictions, we feel that we are struggling with attendance, because women simply do not want to participate in some activities anymore. There are only a few people coming to our events, and we are really struggling with that, because we tried to ask women what's going on in their lives, and they told us, wow, the situation right now is different, I'm tired, and I'm just coming to work, and after work I just do not want to listen to your workshop. I'm too tired for that, and I'm burned out. And we are struggling with it right now, and we are trying to figure it out, how to help our women to overcome this situation. So I think for now that's it, and that was the most important information for us. There are always two sides of the story, positive and negative. It helped us a lot, but right now we are struggling. Okay, thank you.
Well, when the first wave of pandemic started, we started to monitoring the situation, and everything stopped but care. The care started to be the biggest value of the society. Women had to stay in shops, providing services in hospitals, and taking care of kids as well. Some of them had to work double, because schools closed. So we thought this, everybody must see the inequality of taking care in our society, and something will happen, positively happen. We should value care as the biggest thing, and we should also pay for these services that are most important, and the society cannot function without them, and we could see that. And the women in these sectors have much less wages than men in management and top companies and etc. So those could stay at home for the same money, doing nothing, and mostly women, some men of course too, but for this little pay, we're giving the danger of their lives, because we didn't know if it's so dangerous that they will not be able to survive if they get it. And I thought it's so obvious. And we started to kind of bring in this, raising this awareness around it, and saying, but look, you know, if women are taking care of the kids and has to stay at home, they shouldn't be getting just half of their wages for taking care. So then the ministry acknowledged this, and there was this race of money when you were taking care of your children. It wasn't just taking care of them at home. You had to work, and you had to also educate your kids, because the schools didn't start functioning after half a year of closing them, and they are not functioning until now. So it's still a big burden. So in my view, I thought Czech Republic would acknowledge that we do not have gender equality in the Czech Republic, and there will be some positive changes. But you can see yourself, first wave, second, third, and we are getting to the point zero each time when it happens, and we starting to close the institutions and services that when the pandemic worsens, and we do not kind of learn from the time before. So we want to make sure that we learn. And we have brought recommendations that can apply to every of this situation. And it's women should be part of the decision making. Yeah, there is like no women in the decision making. There was this commission for solving the nerve, a commission called NERV, which was like an economic body council within the government. There was one woman. Yeah, so we lack the perspective, and I think the inequalities are raising more, and they are more and more obvious. So how COVID affected our life, we need to work more, but I see it also as an opportunity that this society acknowledges that we do not have gender equality, and that it is an important issue.
Thank you, Hannah. Thank you for bringing the issue of care, because we are actually succeeding the event which was focusing on mobility of care, so it can be interconnected, and we will bring you a space also for your questions or comments. But I would like to make, or do you have any now here from the audience? Yeah, they have. Yeah? Okay. So I but go ahead. No, because I would like to go to another round of specific questions to each of the speakers, so maybe now it's time to follow on the care issues.
It's not exactly the care, but a general question. I didn't want to intervene, right? So sorry. But I'm coming from Hungary. My name is Attila Melek. And we have specific experiences with NGOs nowadays. And then I would like to ask whether the political climate is changing dramatically around you, whether cooperation with the government is, I know there was a governmental change here, right? But we didn't have. So governmental cooperation, and very importantly, social media attacks. So we have been experiencing, we have very similar organization like yours, and we have been very seriously attacked in various times for various things. And, gender and migration, these are the key things, right? Which, like a nerve. And then we are on the agenda. So I'm just asking, what's your experience here? And very importantly, because of course we are not crying about this, is how we can handle this. This is, I think, a much more important question than just to complain, right?
Thank you. It's actually a very relevant question, also here in our environment. And actually, I wouldn't raise it because I didn't think about this topic. So that's great to have this topic. Is there any volunteer? And Anastasia, then Alena will comment. And I think Hannah will have also something to say.
I may say that the situation with NGOs wasn't easy even before the pandemic because of the migration crisis. Local NGOs, especially NGOs helping migrants, has gained really bad image here because of the helping migrants, helping refugees. And every time we are trying to do something with migrants or refugees, we are attacked. Especially big NGOs. We are not so big, like I'm representing Matertera, which is a really small organization, only 5 people, but still, the situation is not good for this sector of NGOs. And if we are talking about cooperation with government, we have very good experience with cooperation with Prague Town Hall, Prague City Hall. We are financially, we get finances from them, we get grants, we are financially supported by them, and also on social medias and medias, we get a really, really good support from them, but we don't have a very good experience with so-called government-organized NGOs. Because some of the NGOs here in Prague are organized by Prague City Hall, and they simply do not want to cooperate with us because we are only a small non-government organization. We are not so important for them. So, thank you.
I can say that Dr. Chekhov became visible. We were invisible organization, almost illegal, because we helped other doctors. We just you told everybody which questions you had on exam. So it was almost illegal because the doctor should be qualified enough to know it by himself or herself. And now not Ministry of Health, but some official medical organization began to support us, and this program Medivac, it was with the support of Minvnitra and Interior, yes, and even our head was I don't know, she was welcomed in. She had a meeting with Andrei Babiš. I don't know if it was a local prime minister. So it was a meeting with a 1-year anniversary of this election of Lukashenko, which after which this crisis just began, and that's it. So we become visible, because we were unnecessary little organization before the pandemic.
And Hannah? Thank you for the question. We tackle this problem from a more like a wider view. We cooperate also with other networks, not just gender equality is involved, but also environment or other also for example LGBT, and that's much worse position than even defending women's rights, yeah, in the Eastern Europe for the last years. And we do all observe what's going on in Hungary with great sadness. I would also agree that before the pandemic the situation was maybe a little bit worse, because there was this attitude coming from your countries against the NGOs. And we have even sociological researches, what issues are the struggling worse and so on. And I would say that in the pandemic, and also the society very quickly grasps these anti-NGO atmosphere and arguments and so on, and especially in the regions, yeah. Like people do not know that they have NGOs in their neighborhood and they are helping elders, vulnerable groups and so on, yeah. So they were invisible before, but there was this visible attack. Then people started to kind of finding out what is NGO, how it works. Unfortunately, there is no politician saying that NGOs are saving money for the state, that it's much cheaper to provide some finances to NGOs than providing new facilities for seniors and so on from the state, because there are these researchers that can compare actually the financial situation. But during the COVID, I think people started to acknowledge that we need social services and healthcare. So these NGOs, if they do this work, they okay. We still do have attacks on NGOs who are kind of called political NGOs, which means, again, I see it from the perspective of our network, just raising awareness and trying to change the situation. Yeah. So even the environment in what the NGOs are working and so on. So I think we still have lots of work, but positively, some people already at least know that there are NGOs, that they help the society and that they are needed. So I wouldn't see it so pessimistically, and hopefully this will continue.
Yeah, I just would add maybe, or do you want to say?
Yes.
So first, Stanislav as
Thank
guest.
you. Yes, I can. Actually, I'm not the person responsible for the external communication, but I know for sure that we were supported by Magistrate of Prague 4, and when the pandemic came, they continued support us, and they considered this project as something useful. So, as I know, we didn't have any problems with this, and hopefully won't have. And another thing that I'd like to add to a prior question, if I have a minute, because I just forgot to say, and this is important, about the influence of the pandemic to the project. I said that there were more positive consequences, but it's not completely true. I think that this project has been changed by the pandemic, and when we went to online format, we, for example, missed this supportive atmosphere of a circle, when people are sitting in a circle and can support each other. But we've got this opportunity to discuss deeper topics, and I can't say that it's better or worse. It's just different projects. And then when we came back to the offline format, we returned to the original idea, but with a new experience. So, thank you.
Thank you. I just would add our experience when it comes to specifically NGOs working with migrants. So, as Anastasia mentioned, we are finding more and more allies among municipalities, which is really great and supportive for us, because for the Ministry of Interior, which is the responsible body of integration, migration and integration both, so they don't put enough stress on integration. We are always stuck in discussions who should be accepted and who not, especially at the labor market. And they see us as antagonists to them, whereas we would like to develop more partnerships, but it is a long way for us to develop this. And what is very important, that the finances are shrinking continuously. So there is a huge fight for European money, let's say, for survival to all NGOs, not only from migration sector, but also from others. And when it comes to other policymakers, for example, it helped us a lot to go through gender equality issues rather than through migration issues. So at least at the strategic level, or in communication with some governmental bodies, we had more success when we changed the core of our efforts. Yeah. So, and maybe I would follow on these questions to Stanislav, because there was an interesting point in your presentation about the 4 discussions, I, we, they, and us. And I would like to ask you, because there is still this we and they, when it comes to the relationship between Czechs and migrants. So what were the findings in those groups of they and us? Is there any change in the attitudes during the pandemics, or do you think it's we are still in the same at the same level of not really accepting migrants among us.
I'm not sure that I know a lot about it because I wasn't a facilitator in these groups. But what I know from my colleagues is that they discussed expectations and fears more than concrete situations. And a lot of people reported about difficulties with understanding of different mentality, because on the one hand, we are quite close. I mean, people from Russia, from Belarus, from Ukraine, but on the other hand, we are quite different. I mean, our culture and our mentality. And it helps, and at the same time, it could create difficulties. And I know that people told us about unjustified expectations that Czech people would make friends with them, for example, and they wouldn't. And people felt something like different difficult feelings, and it create additional difficulties in cooperation with natives. Yeah, and I don't think that pandemic changed the situation, because the level of isolation became worse, and yeah, I don't think so, unfortunately.
Yeah, okay. But it's great, actually, that you provide these support groups, because in the Czech Republic it is very rare to find psychological support in other language than in Czech. So, and on the policy level, there is no progress in this sense. So we hope that you will be able to continue with these exchanges with migrants. I would go to Anastasia, because you created a product, or how to say it, the time bank, which is like a barter, let's say, of services or skills among women. So I would like to ask you to give us some more details, and if it during the COVID you think it could be like an opportunity also for the future to develop this like sharing instead of going to workshops and pay like for attendance when you get the cosmetics or hairdresser, or I don't know what are actually the skills that the ladies propose or offer.
It can be everything. Really, because we are working, we decided to dedicate our time to Time Bank because we try to empower our women and show them that they actually have skills. They have skills they can pass to other people, to share with someone who maybe want to know how to do it. And it's a very empowering, inspiring feeling to know that I can share something I can do, and I can teach someone to do this thing. And also I can get something in exchange as well, if I want. So by providing their services or their time, for example, 1 hour, or one example. For example, I decided to register for Time Bank activity, and I can provide a class of project management or career guidance for free. So the organization can find a suitable client for me, and this client will go to my class, and after that this client also can provide their services or can pass their skills to someone else. Because if you're using this service, you should provide 1 hour of your time to someone else as well. So we are just using time like payment units. We are not using money, and we are paying by our time. When I'm providing a service for someone else, I'm gaining 1 point, for example, 1 point for 1 hour. So I can get 1 class of something from someone else for free. And vice versa, when someone is getting an hour with me, it means that this person should also organize something for someone else. And we have a really wide range of classes, for example, project management, Georgian cuisine, event management, PR, marketing. It's everything you can pass to other people.
Okay, thank you. Actually, the offer is quite, like, let's say, qualified, high-level skills. I would expect rather language learning or cooking, but it's a lot about managerial skills.
Yeah,
So,
language is cooking as well, but we are started from ourselves. That's why we decided to provide classes in something bigger.
Yeah, it is quite innovative in the rank of NGOs, and it can be a part also of circular economy, which is quite a fancy trend in the Czech Republic nowadays, or the zero waste trend. Hannah,
I'm curious, what happened to the time bank under COVID?
So we just provided these classes in Zoom. We just match the pairs. For example, when someone is interested in some skills we have within our time bank database, we just pass the contact of this person to the client. And after that, we just asked if the consultation was provided and how was it, if it was successful. And based on this information, we just fill the information into our database that it was successful and it was a win-win situation for the both sides.
okay. And I would have a question to Hannah. You are not supporting like women as the target group directly, but the member organizations. So if you could give us some examples, how do you support your members, and vice versa, what were your gains or new experiences from the coalition of invisible power, because it was quite a new topic for you to work with. So
Yeah, I would like to say that actually the format that we cooperate on some project with a members organization is most successful because we get to know each other. So and also to having diversity within our network, it brings new issues, new views into our discussions and into solving the problems. So anybody who is interested in promoting or defending women's rights and has the same values as us is welcome. And I think this is my main purpose of our work, that we actually talk to each other and we cooperate. And we have working groups within we discuss different issues, empowerment of women in economics, violence against women is an important issue, and we have organizations supporting the victim of violence. Also, we have a working room on obstetrics, which is quite established, and they've been trying for change and the support of community assistance for a long time. Also, we have working group for education and even for the issue how to communicate gender equality within the society. And we involved our colleagues from the Roma group Manushe and also from SIMI into our working groups. And we discussed how these issues that we are working on and we want to change positively, how impact these vulnerable groups. and we found so many same experiences. But unfortunately, if you are a Roma or migrant woman, usually your experience is even worse, and the discrimination is worse than for the other groups of women. So what I learned from this cooperation is that we need this more. We need more discussion within our organizations and bring in the problems of real women together, because then we can be stronger. And when we want to advocate for some legislative changes or even measures now while the COVID situation, it's very important to know what impact will be on different group of people within our society.
Okay, thank you for this contribution, and I would follow up with Alena when it concerns your need of discussing the issues from different perspectives. So now we have a huge debate in the public discourse about the vaccinations, of course. And so Alena, she gathered some information from their support in chat, where the healthcare workers shared with her the experiences, like how was the situation of migrants regarding the COVID tests and vaccinations, because as we said, there are huge differences here among migrants who belong under the public healthcare insurance and those who are excluded from this public system and need have an obligatory private commercial insurance, which is much more limited. So, Alena, if you could share with us,
private insurance is obligate. It just works. I will just explain how it works in 2 words. A migrant have to pay. It's now this sum of money tripled, and the sum is the average salary for one member of the family if it's young and healthy, and if the member of the family has underlying diseases or he or she is older than 60 years old, the sum is huge. It's 130,000 crowns per year. And the people who have this insurance have to pay in advance for their medical services, then send the papers to insurance company, and maybe yes, maybe no, they will get money back during the. So how it works. And about tests, so people have to pay for their tests by themselves, and a lot of families who are struggling to make ends meet, they just avoid those tests, avoid, even if they will be tested positive, they just avoid not to pay this money, because price of PCR tests in this summer was 1,500 crowns, something like that. Now it become cheaper, but for sure, if there are 4 members of the family, and it's a huge amount of money, and that's the problem not only for these migrants. That's the problem, epidemiological problem for the whole society, because we can track all the people who can transmit this disease. And about the vaccination situation was even worse, because those people who are excluded from this medical system, no matter if they old or young, if they healthy or have some underlying conditions, they were the last who got access to this vaccine. There was a system, so it was impossible. They were the last, even people, that was a group 25-90, I think, something like that, and after that, those foreigners. So I'm 40, and in my age group, the difference was 1 month, but for people who Czechs, so for example, 60 or 65 years old could be vaccinated in March, and foreigners could be vaccinated only in July. I was 13th of June. I was the 30th of June. I was one of the first migrants with commercial insurance who was vaccinated, and after that, it was just this vaccination campaign began. And now, after the 1st of November, this vaccination become cheaper. And another problem that foreigners had to pay. If the family has some members of the family with health issues, or they will have problems to get to their workplace, they will go and get their jab. But if they do not care. There are a lot of people who are young and they just do not care. And they will not pay 900 crowns? Yes, 900 crowns for one jab, and for the second, the same sum of money, and wait for this money back for 3 months. They do not understand why should they do it. Yes?
Can I ask a question of clarification? I did not really understand. So if you speak about it, so how actually does the government know who is a migrant and who is not?
No, that's just you cannot be included into this health care system. Just you have dlouhodobý pobyt. That's that's who do not have permanent residency. They just cannot go to any insurance company and say, I want to be a member of medical insurance. Yes, it stops with the residents. Permanent residents drastically change everything. So, and people and their members of their families who do not have permanent residence, even little children, even newborns, they do not have their... Yes, for 2 months, but the insurance for pregnancy now costs 3 times more. It's the whole pregnancy, whole cover, it's 100,000 and 30,000 crowns. It's a huge amount of money, and especially for the families who were not prepared. For example, she was pregnant 20 or 12 weeks pregnant, and they didn't have this huge amount of money. And even our doctors, gynecologists, who worked in obstetric clinics, they gave advice what to do, how to deal with that, because there were family, and our just gynecologist, Elena Stachova, she gave those advices, because with testing, with those vaccination is not a huge, those women, migrants who were pregnant and just they didn't pay for their insurance before these amendments, it's awful for those families. I think they will have to take some credits or anything. I don't know, sell a car or anything. It's a huge amount of money.
If I may interrupt, I have one question from online.
Yes.
Douglas, so if you unmute yourself, you can ask the question. Go ahead.
Thanks. I'm Douglas from Kampala, Uganda. Thanks so much for the presentations on the perspective of the NGO sector. And I would like to supplement and also ask a question, because I'm looking at care in the border communities, particularly in East Africa, in Uganda, where migrants are placed in resettlement areas. These resettlement areas are seen as humanitarian spaces, or as political spaces and emotional spaces. Most non-governmental organizations and international organizations, they provide healthcare and social services to the migrants, and also, but not giving health insurance, because the government and OPM and other development actors, they tend to provide these services. But I'm quite asking for the sake of German migrants or other migrants that are moving to Czech Republic, for the case of permanent residents, for those who are put on institutional care or home-based care services, could there be possibilities that these migrants, when have, or if they receive the care, maybe health care, could they have options of returning back to their country of origin? That's the question I wanted to ask. Thank you so much.
Yes, they usually, I mean, the doctors, if something serious can happen, those migrants for sure can come back for just for some time to country of the origin and get a medical help here. So it's, I think it's not a problem, and I mean, get a medical help there. But the majority of people for sure wants to get a medical help in the country of residence.
Any more questions from online? Thank you.
So can I, with this vaccination testing, and
like
yes,
two
it's okay.
sentences.
Yes.
Because
Okay.
we are running out of time. Yes. Okay. Do you have any questions from the audience? If not, so yeah. You too. Okay. So I give the space for the two questions of yours and yeah.
Yeah, actually, also for Alena, kind of because you were also mentioning, that now people pass the exams and so on and so on. So like it seems to be that those health professionals are more valued. So I was wondering how this then plays out in, for instance, the access to vaccination, if you would work in health services and so on. That was the first question. But in general, I had a question about your NGO, which I find really interesting how you phrased it, that it is for health professionals with diplomas from outside of the Czech Republic. But so in a way that opens up a big group of people. And so for me, that sounds strategic that you call it like that. So I was just curious about that. And if I may, I also have a question for Anastasia, because you mentioned that your NGO is open to women with migrant background and to women with non-migrant background. And I think that is also really interesting. And I was just curious how far and in what sense the NGO also becomes a meeting point, for women to connect with each other, which kind of links up with what Stanislav was talking about, that there is actually this experience of being alienated from the Czech context. And did I understand it correctly that you are mainly working with men? Is that true?
No, it's not true.
Ah, okay. Yeah.
First, okay.
I will just ask directly my question as well. And my question also concerned the vaccination, because not the vaccination, but the health insurance, because as you mentioned in your introduction, and I know it was a big campaign, against the against this update in law. But so yes. Could you tell us a bit about obstacles, but also what actors then were the one defining the law and just really...
That's a monopoly. That's just the monopoly of one company.
Yeah,
yes.
I know. So
Yeah.
they wanted to know also from your point of view, what was the campaign?
Campaign
what was the discussion about that?
I will begin from your question. For sure, those health care workers who work in the healthcare in the meantime, so they got the access with the. They were the first one, but there are health workers who on maternity leave and so on. So no, those ones got get their jobs later. So if the person works in hospital, for sure he or she will get the job first. About these new amendments, it's a monopoly, and I couldn't say that the campaign was huge. Against this PVZP monopoly. So it's a disaster to a majority of our families, because it's a family who raise 2 or 3 children. They have to pay 2 or 3 income. Income in the Czech Republic just for the whole year of insurance of their kids. It's very unfair. And if you want my personal opinion, we don't have a vote. And we paid with our money for the disaster which happened in year 2020 here with those our flooded hospital and so on. So we don't have a vote, and we had to pay.
Yeah, actually, what I heard, there was a huge lobbying from the private companies.
Yes.
And unfortunately, the ministries, they had to admit that they were not really prepared for this during the legislative procedure. So there were only few MPs, members of parliament, who were prepared to give arguments against this race, but it was not sufficient. So yeah,
the only amendment which brings benefits is those newborns. It's the case of Theodore and Leona, who were premature born several years ago, as we do remember. It was a student girl who just had her basic insurance, and that was 12 weeks. There was 4 months in the hospital, a huge debt of this family. Yes. And after this case, this at least something changed. I do remember this awful, but everybody survived. It's okay. Those kids are healthy, and those twins.
You. And there was a question to Anastasia, and I will give the mic in the meantime to Mr. Attila.
So we are just trying to create a safe space and a community for migrant women, and we also welcome women with non-migrant background, because we want to, as you said, we want to make it as a meeting point for women from different cultures, different countries, and we want to combat social isolation for these women. We're also doing that by contacting professionals. Sometimes our events are, sometimes local professionals working with migrants or working within social services are attending our events to know this woman better, maybe to provide their services to them, because we are aware of the fact that we are providing career guidance, coaching sessions. We can cover some topics, but our clients sometimes are coming with more complex issues, such as domestic violence, social problems with legal status here. And unfortunately, we are not we don't have necessary skills to provide counseling in these questions. That's why the cooperation with NGOs is important for us. It's important for us to have contacts to lawyers, to social workers, to career counselors, maybe some debt counseling in some cases. And yeah, so the cooperation with Czech majority is very important for us.
In case we have time. Okay. Sorry for coming back to your time bank again, but I think it's important for various reasons. You are doing this time bank only among the migrant women, right? Or it's with others as well? And then I have a second question, just to try to quicken it up, is that when you see this time bank operating, we all know that this model is in care. For instance, it's very much promoted as some kind of an alternative and something like that. Even in the long run, that you put things in care this year and then 15 years later you can get it back, right? So there are such things. The question I have is, because you are doing it, is what kind of problems and conflicts emerge in this time bank management? Because I think that's very important. We talk a lot about market, what it's doing, but what about the time bank, right?
So this time bank is also open for women with non-migrant background, so we are open for everyone. So far, we didn't experience the situation that a man would be interested in our services within the time bank, but maybe in the future, some men will be interested in these services as well. But here we have another issue, that we are not sure that in this case we can provide a safe space for this woman who will be matched with this man. In this case, we need a supervision, which is not good for this kind of cooperation, because the base for this activity is mutual respect. And that's why we do not involve into the meetings of our clients. And probably in the future, when the time bank will be promoted, maybe some men will have interested in this kind of activities, but we need to set the rules for that. Of course, in the future, we want to promote it more, to have more wider range of skills we can provide, wider range of topics.
I'm so curious, how do you deal with that something you offer as a service, but which takes that as a service, let's say half an hour, but the preparation for it takes like 3 days. So like the equivalent in the exchange, I mean, how do you take care of that?
So far, we didn't experience some kind of this kind of questions from our clients. If they have problem with the fact that they have to prepare for that. In many cases, these kind of meetings doesn't require any special preparation. Not like it wasn't a kind of like huge workshop for someone. It just like the typical meeting looks like that. Two persons are just like naturally communicating on this topic. Sometimes if we are discussing some special skills like project management, event management, it just they just pass their impressions, basic information on this topic to the other person. But it's a very good question. We should think about it. Thank you.
I think Atila's question also comes from something like that. It's like a laboratory, right? It could be a model for the wider society. And so in that sense, if it becomes so if this would be a model like for solving problems in the wider society, then, for instance, the time you have to invest in getting the education to be able to do project management needs to be counted in the exchange. Or not, I don't know. You know, like there could also be alternative models. Right now, that is the basis in our meritocracy societies why people who have a longer education earn more, which can be challenged, you know. Do we need to do that? Because it's also a privilege to get the education, and so on and so on. You could go far. But basically, I think, you know, the time bank is really super fascinating as a kind of laboratory, like for the wider society.
You're right.
I would love to hear more about this.
They're using their own experience in general. So like you are supposed to, like I am one of the members, very inactive, but as I understood the concept, it's that you are expected to offer in something in what you are very familiar. So you are not expected to have huge preparations, as Anastasia said. Yeah. Mm-hmm. Yeah, but it's meant like. Well, I think it's meant in some way as voluntary work, yeah? Yeah. So it's volunteering. So let's see it from this perspective, that you volunteer to teach someone something or provide the person with your skills.
Yeah, you're right, because we are working with the premise that this person is willing to provide this hour of their time, for example, for free, or for one unit of one point within our time bank. Of course, as I said, we didn't experience this kind of questions yet, if someone is highly skilled.
I'm sorry, I have to stop you now. It's great to see your interest in the topic. I'm sure that Anastasia will talk with you after the event. And now it's time to thanks to our guests and also to organizers for having us here. And we hope that this discussion brought you some new or other different perspectives as you are used to. And we hope also that we had some online viewers. Because for most of our guests, it was their first opportunity to speak publicly about their work. So thank you for your attention.